Hi, Dr. Chatta. Thank you so much for joining us on your, I'm sure, a very busy day for you. We'd love for you to introduce yourself and tell us a little bit about where you're from and why you do what you do.
It's a great pleasure to be here. My name is Chatta, and I'm the head of GU Oncology, which is genitourinary oncology at Roswell Park Cancer Center. And my main area of research is prostate cancer. So I originally trained in India. I did most of my oncology training at the University of Washington in Seattle. And then I moved to Roswell in 2016, to really continue further my career. And I think one of the main things I was attracted by was the tremendous research that was going on here, specifically in the area of immunotherapy, and also, very broadly speaking, in the area of prostate cancer.
So for prostate cancer, could you describe what it is and maybe what some signs of prostate cancer could be?
Sure. So again, as you probably well know, prostate cancer is a uniquely male disease. So only men get it, and it's really very common. And I think that the big challenge in prostate cancer is not only the diagnosis, but who do you treat, who do you not treat. If you look at it, 1 in 7 men in this country will develop prostate cancer. Truthfully, if you look at even men over the age of 50, they probably have flecks of prostate cancer in a significant number, maybe 50 to 60%. But then again, it doesn't mean it has to be treated. And so the big challenge is, when do you screen? And once you do diagnose, how do you best handle it? And again, the main challenge at the time of diagnosis being, should you treat or should you not treat? And now again, we've steered away from that. So even in men who we want to observe, we actually call it active surveillance. So just because one doesn't do prostate-specific treatment, it's not that you're not following them. They're followed pretty closely to see when they develop reasons. I'm straying away from signs and symptoms because most prostate cancer really doesn't present with signs or symptoms. So the commonest way men, at least in the US, they're diagnosed with prostate cancer is they have a elevated or a raised PSA. Now, PSA is a blood test which is used for diagnosing prostate cancer, or it's a sentinel sign or sentinel reason as to why to do a prostate biopsy to make a diagnosis. And the majority of men who are diagnosed, that's 80–90%, they really have no signs or symptoms. And all they have is an elevated PSA, they have a biopsy, which then leads to a diagnosis.
Is there an age that a male should get tested with their PSA level?
Yeah, so I think, if you kind of look at the last 25, 30 years, we've kind of gone back and forth on that. We never used to screen for prostate cancer, so now I'm kind of going back into the late 80s, early 90s, because that's the time the PSA test was becoming available. And the majority of men who presented with prostate cancer, they had metastatic disease or cancer that had already spread outside the prostate. And once it's done that, you can buy men good time, but there is no cure. Once the PSA test became available, then screening, became an important tool. Men would have a rectal exam done, and obviously if they had an enlarged prostate, so again, these are men who are not symptomatic, they had enlarged prostate, and if it felt abnormal, then they had a biopsy done. Once the PSA became available, the two screening modalities were a PSA test and a rectal exam. So then I think if you look at the 1990s and the early 2000s, we probably had a lot of screening. So the number of cases with prostate cancer went up, and maybe there was also overtreatment. So then there was guidance, from a number of organizations that maybe screening should not be done. So now when you come into 2015 onwards, again, we found that the number of men with metastatic prostate cancer was going up. So clearly, we know that it's a good thing to screen. The challenge is, how do you decide who needs to be screened? So, right now the guidance is if somebody has a family history, or if somebody is African American, because African Americans, not only are they diagnosed at a younger age, they also have more aggressive prostate cancer. With either of those two criteria, men definitely need to be screened. Whereas the general population, I think the guidance is, you should have a rectal exam, probably should start getting screened beginning the age of 50, but maybe you don't need it every year. Depending on what the PSA is, you can space out the interval. So again, we've kind of gone through, back and forth, but, as of 2020, both family history and men in general probably ought to be screened.
How important is the community support for research, for dollars that are donated to Roswell Park? How important are those dollars for the research that your department may be doing?
I think it's crucial. And again, using prostate cancer as an example or paradigm, there are many, many facets to research, right? So one is a simple thing like, should men be screened or not? Which I think is more or less settled. I think all of us agree they should be screening in some sort of a nuanced manner. Clearly men with a family history, or if somebody's African American, for sure. And then, the rest of the men probably at, maybe not every year, but at certain intervals should be done. So, that was all the result of good research. Subsequently, where it becomes important is once you've diagnosed somebody, who do you treat, who do you not treat? And again, I kind of want to stay away from the word no treat. It's really active surveillance. So again, it's active intervention. You're following men closely. That again was the result of good research. And then specifically with respect to Roswell Park, we have like some amazing scientists who are, even currently working on stem cells in prostate cancer, working on epigenetics, working on immune treatments for prostate cancer. And none of that would be possible without, good community support. The other place where I kind of feel very strongly about, I think community support is crucial, is really a conversation or a partnership. Because men live, since the journey for men with prostate cancer is very long, there are also a number of side effects which result from the treatments, that we use. Again, the main standard treatment for advanced prostate cancer is hormonal treatment, which for the lack of a better word is really depriving prostate cancer of testosterone, which is the main fuel for prostate cancer. And that has a number of consequences. Again, I think it's really an extreme form of menopause when you treat men with hormone therapy. And for that, I think we really need a true partnership with the community on how best to help men. And I think no one person has those answers. You really need a multidisciplinary group. In fact, we have set up a whole prostate cancer hormone therapy group where we kind of, educate men with what the side effects are, both men as well as their loved ones. And again, we could not do that without their input, without their support, because, unless we have a conversation with them, we don't really know what they want. And again, we also use that as a forum to educate them about all the new treatments we have at Roswell. And again, without the research support, we never would have been able to do any of that.
So just recently, Roswell Park was ranked number 14th in the entire country for cancer care. Right. How does that feel for you and your colleagues here at Roswell?
I think all of us are tremendously proud of that. I think it's a great honor to be ranked in the top 10, 20 cancer centers in the country. And again, I think it's a testimony both through the leadership here as well as a tribute to all the people who work here. And again, when I say all the people who work here, the community is included, because without their support, we would not be what we are.
So we have thousands of players who play in our event, the 11-day power play, every year. They train physically, and they raise funds for several months to support the hospital here. Do you have a message for those hockey players? Are you a hockey fan? Anything that you'd like to share with them?
Right. I would like to thank all of them for their support. Again, that's a part of, again, getting community support. And without their generosity, their goodwill, they're donating the time, I think a number of things that we do would simply not be possible. So once again, a big thank you to them.
Thank you, Dr. Chatta, for all you do.
Thank you.
Thanks for joining us today.
Thanks.